We've all been there. You wake up with a headache, or your joints are aching, or maybe that old back injury is flaring up again, and you reach for the trusty bottle of ibuprofen. It's sitting in your bathroom cabinet like a loyal little pain relief soldier ready to fight another battle. It's over the counter, it works fast, and it feels harmless. But here's the million-dollar question. What happens if you start needing it every day? Is that actually safe? Let's break it down. First off, ibuprofen belongs to a class of medications known as NSAIDs. That's short for non-steroidal anti-inflammatory drugs. That sounds fancy, but in plain English, these meds reduce inflammation, relieve pain, and lower fever. It's basically your go-to sidekick when you've overdone it at the gym or caught a nasty cold. For occasional use, like after a tough workout, during a fever, or when a migraine strikes, ibuprofen is generally considered safe for most people. But when once in a while turns into every single morning, things get a little more complicated. Daily ibuprofen use can increase your risk of several health issues. Let's start with your stomach. Ibuprofen can irritate the protective lining of your stomach, which can lead to ulcers or gastrointestinal bleeding over time. Imagine using sandpaper on a balloon. Sooner or later it's going to pop. Taking ibuprofen daily is kind of like that, except your stomach is the balloon. And here's a plot twist many people don't expect. Ibuprofen can also mess with your kidneys. Your kidneys are the body's filtration system. They clean out waste and keep your fluids balanced. NSAIDs like ibuprofen reduce blood flow to the kidneys, especially when taken in high doses or over a long period. This can lead to kidney damage, particularly in people who are older, dehydrated, or already dealing with kidney problems. So if you're chugging ibuprofen like it's multivitamins, your kidneys might be quietly screaming into the void. Now, let's talk about your heart. Daily ibuprofen use has been associated with an increased risk of heart attack and stroke, especially at higher doses. This risk is even higher if you already have a history of heart disease or high blood pressure. So yes, ibuprofen might help your back pain, but it could be giving your heart a little extra stress on the side. It's like hiring someone to fix your leaky faucet and finding out they broke your roof in the process. Speaking of blood pressure, did you know that ibuprofen can raise it? If you're already taking medication to lower your blood pressure, ibuprofen could be quietly undoing all that good work. It's like trying to fill a bucket with a hole in it. Not very efficient. And let's not forget the potential for drug interactions. Ibuprofen can interfere with several medications, including blood thinners like warfarin, ACE inhibitors used for blood pressure, and even some antidepressants. So, while you may think you're doing something harmless, ibuprofen could be stirring up a chemical soap opera in your body without your permission. Now you might be thinking, what if I only take a little, or always take it with food? Doesn't that make it safer? Taking ibuprofen with food can help protect your stomach a bit, and yes, using the lowest effective dose is always smarter. But even with these precautions, daily use still carries risk. The issue isn't that ibuprofen is bad, it's about how often you use it, how much you take, and what's already going on in your body. There are people for whom daily ibuprofen use is medically justified. For example, someone with rheumatoid arthritis or another chronic inflammatory condition might take NSAIDs regularly to manage pain and inflammation. But here's the key difference. In these cases, doctors are monitoring that use closely. They'll check kidney function, liver enzymes, and blood pressure regularly. It's not a pop a pill and forget about it kind of deal. It's more like driving a race car. You can do it, but only with the right gear and supervision. Here's another thing to consider. If you find yourself reaching for ibuprofen every day, maybe the issue isn't just pain. It's that your body is trying to tell you something. Pain is a symptom, not a diagnosis. Masking chronic pain without figuring out what's causing it is like taping over your car's check engine light. Sure, it's not blinking anymore, but the engine's still in trouble. You might benefit from physical therapy, lifestyle changes, better posture, or even switching to a medication that addresses the root cause more effectively. So, is it safe to take ibuprofen every day? Here's the short answer: not without medical supervision. If you find that your pain or discomfort is constant enough that you're tempted to use ibuprofen daily, it's time for a conversation with your doctor. They can help figure out what's causing the pain and what the best treatment plan is, not just for relief, but for long-term safety. Now, let's sprinkle in some good news. If you're using ibuprofen occasionally, say for menstrual cramps, a headache after a rough day, or soreness after helping your friend move out of their third-floor walk-up apartment, you're probably fine. The occasional dose, especially when taken as directed, is unlikely to cause major harm in most healthy people. But daily use? That's another story. What can you do instead of taking ibuprofen every day? Well, there are some alternatives worth considering. Acetaminophen, for example, doesn't have the same stomach or heart risks as ibuprofen. It's not an anti-inflammatory, but it can help with general pain. Just be careful with dosing. Too much acetaminophen can harm your liver. You might also explore non-drug options. Physical therapy, stretching, yoga, massage, acupuncture, or even simple lifestyle changes like a better mattress or ergonomic work setup can sometimes reduce the need for daily medication. Turmeric supplements, omega-3 fatty acids, and anti-inflammatory diets are also gaining popularity, though their effectiveness can vary. And sometimes simply hydrating better, getting enough sleep, or moving more throughout the day can lower overall pain and inflammation. Your body really does like it when you treat it well. Here's the real takeaway. Pain relief should never come at the cost of long-term health. Your goal shouldn't be to numb the pain into silence. It should be to understand it and work with your body, not against it. If you're young and healthy, you might feel like you're invincible, but the effects of long-term medication use can sneak up on you over time. That's why it's worth having these conversations now, not after problems show up. And let's be real. If you're taking ibuprofen every day just to survive your job, your desk chair might be the real enemy here. Just saying. So to wrap it up, is it safe to take ibuprofen every day? Not really, unless your doctor says so and you're being regularly monitored. For most people, ibuprofen should be an occasional tool, not a daily crutch. If this video gave you a better understanding of how ibuprofen works and what it can do to your body with long-term use, consider subscribing. I'm here to give you practical health advice, bust medical myths, and help you make smarter decisions. Because let's face it, Google isn't always right, and your body deserves better than guesswork. In the next video, we're diving into another long-standing health myth you've probably heard since kindergarten. Drink 8 glasses of water a day. Is that advice solid or just soggy science? Stick around and let's keep building your health knowledge one clear, fact-checked sip at a time.